Mental health disorders affect thoughts, emotions, and behaviors, impacting daily life and well-being. Understanding this condition is crucial for providing effective care. This video presentation outlines various psychiatric, neurodevelopmental, eating, and psychosexual disorders, detailing their signs, treatment, and also nursing interventions to enhance patient care and support. What is schizophrenia? Schizophrenia, it is a chronic mental disorder characterized by disturbances in thought, perception, emotions, and also behavior. Also naga-include po diri ang hallucinations, delusions, disorganized thinking, and also impaired social functioning. The exact cause is unknown, but it is linked to genetic, neurochemical, and environmental factors. So there are types of schizophrenia. First is the disorganized schizophrenia. The signs and symptoms are disorganized speech and behavior, inappropriate emotional responses, and also difficulty with any daily activities. Ang treatment ani is antipsychotics like risperidone or olanzapine, therapy, and any other social skills training. Ang atong nursing interventions ani are maintain nato ang structured environment and also magamit ang mga communication and also encourage nato ang patient to self-care and also hygiene. Next is the catatonic schizophrenia. The signs and symptoms are motor disturbances such as rigidity, stupor, excessive movement, echolalia, or echophagia. Ang treatment nato ani is benzodiazepine, electroconvulsive therapy or the BCT, and also for severe cases. Our nursing interventions is we need to ensure safety, encourage patient to movement, and also mag-provide taong emotional support sa patient, and also we need to monitor their nutritional needs. Next is the paranoid schizophrenia. The signs and symptoms are hallucinations, delusions of persecution, extreme suspicion, anxiety, and hostility. Ang treatment nato is antipsychotics combined with cognitive behavioral therapy or the CBT. Our nursing interventions is we need to promote trust, avoid confrontation, ensure medication adherence, and also maintain nato ang calm environment. Next is the residual schizophrenia. Signs and symptoms are past history of schizophrenia with mild remaining symptoms but no active psychosis. Ang treatment is antipsychotics, psychoeducation, and also community support programs. Our nursing interventions is encourage social interaction, monitor for relapse, and also provide ongoing support. Next is the undifferentiated schizophrenia. And signs and symptoms ani is mixed symptoms that do not fit the other types. Treatment is a combination of medications, therapy, and psychosocial interventions. And our nursing interventions to this disorder is we need to assess symptoms regularly and also mag-provide po ang mga structured routine and also encourage adherence to treatment. Next is the maladaptive patterns of behavior. First is the schizophreniform disorder. It is similar to schizophrenia but nagalast siya only 1 to 6 months. Ang signs and symptoms ani is hallucinations, delusions, disorganized speech, and also social withdrawal. Treatment is antipsychotics, any therapy, and also close monitoring sa patient. Our nursing interventions is we need to provide emotional support, monitor for transition to schizophrenia. Next is the schizoaffective disorder. It is a combination of schizophrenia and a mood disorder like depression or bipolar. Ang signs and symptoms ani is psychotic symptoms like hallucinations or delusions alongside sa mood instability. The treatment are antipsychotics nga combined with mood stabilizer and also antidepressants. Our nursing interventions is we need to encourage the patient to medication adherence and also monitor for mood changes. Next is the delusional disorder. It is a presence of persistent non-bizarre delusions without other schizophrenia symptoms. Our signs and symptoms of this disorder is strong beliefs that are false but possible. For example, is being followed siya per me. Ang treatment is antipsychotics and also cognitive therapy. Our nursing interventions is i-avoid nato ang patient directly sa challenging delusions, and also we need to build trust and provide structured support. Next is the brief psychotic disorder. It is a sudden onset of psychotic symptoms nga nagalast for less than a month. Our signs and symptoms is hallucinations, delusions, disorganized speech, and also confusion. Our treatment is short-term use of antipsychotics, therapy, and any supportive care. Our nursing interventions is provide reassurance sa patient, ensure safety, and also monitor na to ang lahang recovery all the times. Next is the shared psychotic disorder. It is a person nga nag-adapt og delusion sa other individual. Ang sign and symptoms ani is 2 or more people sharing the same delusional beliefs. Ang treatment is separation from the primary delusional individual and also any mga therapy and also medication if needed. Our nursing interventions is it reduce na to ang reinforcement sa delusion and also encourage na to ang patient to any therapy. Next is ang fetal alcohol syndrome or the FAS. It is a condition caused by alcohol consumption during pregnancy which magalid sa physical and developmental abnormalities sa ka-pregnant. Our sign and symptoms is growth deficiencies, facial abnormalities like thin ang ilahang upper lip o small eye openings, and also intellectual disability and behavioral issues. Our treatment is no cure, but supportive therapies like speech therapies, occupational therapy, and behavioral interventions. Our nursing interventions is we need to educate the pregnant woman about alcohol risk and also mag-provide po ng mga early interventions sa mga affected children. Next is the attention deficit hyperactivity disorder or the ADHD, which it is a neurodevelopmental disorder nga characterized by an attention, hyperactivity, and also impulsivity. Ang sign and symptoms nato ani is difficulty focusing, excessive movement, impulsive decision making, and also trouble when it comes sa mga instruction, mag-follow mga instruction. Our treatment is stimulants, methylphenidate, amphetamines, and also any behavioral therapy, and also we need to educate the patient for any support. Educational support. Our nursing interventions is we need to provide a structured routine, use positive reinforcement, and involve parents sa mga behavioral management therapies. Next is the autism spectrum disorder or the ASD. It is a developmental disorder nga nag-affect sa communication, behavior, ug social interaction sa usa ka bata or any individual. It ranges from mild, which is high functioning, to severe, which is low functioning. Our sign symptoms is difficulty with social interactions, repetitive behaviors, speech delays, and also sensory sensitivities. Treatment nato is behavioral therapy, speech therapy, medications for associated symptoms. And our nursing interventions is to maintain nato ang structured environment, encourage communication, and support sensory needs. Next is, what is mental retardation? It is now referred to as intellectual disability or the ID, which naga-involve siya significant limitation in intellectual functioning and also adaptive behavior. So, there are levels of intellectual disability. So, first is ang mild, which is ang IQ niya as 50 to 70. Ang signs ani niya is can live independently with support. Treatment is special education, vocational training, and our nursing interventions is we need to encourage the patient independence and also structured learning. Next level is the moderate, which is ang IQ is 35 to 50. Ang signs is need supervisions for daily activities, treatment, special education, and also life skills training. Nursing interventions is we need to assist the patient with daily tasks, encourage socialization. Next is the severe IQ, which is ang IQ is 20 to 35. Ang signs is requires constant supervision. Treatment is support care and also therapy. Nursing interventions is we need to ensure the patient safety and also i-assist nato ang lahang daily activities. Next is the profound, which is ang IQ is less than 20, which is needs good signs niya is total dependency. Treatment is full-time care and also therapy. Nursing interventions is we need to provide comfort to patient and also manage ang lahang physical health. Next is delirium versus dementia. So, ang delirium mo ni siya ang sudden onset, fluctuating course, often caused by infection or medication. Whereas, ang dementia is gradual, progressive decline in memory and cognitive function na commonly seen in sa mga patient na ay Alzheimer's disease. So, what is Alzheimer's disease? It is a degenerative brain disorder leading to memory loss and also cognitive decline. Ang signs and symptoms niya is memory impairment, confusion, personality changes, and also difficulty performing daily tasks. Ang treatment is cholinesterase inhibitors or donepezil, and also ini mga supportive care, and our nursing interventions is maintain routine, ensure safety, and also provide emotional support sa patient. Moving on sa mga eating disorder. So first is ang PICA. So muna siya ang persistent eating of non-nutritive substances, for example kan mga dirt, peppers, soap for at least 1 month. Ang sign and symptoms ani is compulsive eating of inappropriate items, gastrointestinal issues, and also nutritional deficiencies. Ang treatment nato is behavioral therapy, nutritional counseling, and also treatment of underlying causes, for example is iron deficiency. Our nursing interventions is monitor nato ang patient for any complications, educate patient on healthy eating, and also assess for underlying conditions. Next is ang rumination disorder. It is a repeated regurgitation of food which may be re-chewed or re-swallowed or spit out. Ang sign and symptoms is weight loss, malnutrition, acid reflux, and also bad breath. Treatment is behavioral interventions, speech therapy, and also treating underlying medical conditions. Our nursing interventions ani is encourage nato ang patient to a smaller, frequent meals, monitor ilahang weight, and also mag-provide po taog any psychological support. Next is ang anorexia nervosa. It is a restrictive eating leading to dangerously low body weight due to intense fear of gaining weight. Our signs and symptoms is extreme thinness, amenorrhea, bradycardia, lanugo or fine hair growth, and also distorted body image. Ang treatment nato is nutritional rehabilitation, psychotherapy, and also antidepressants if needed. Our nursing interventions is monitor nato ilahang vital signs, encourage gradual weight gain, and also mag-provide po taog ini supportive eating environment. Next is the bulimia nervosa. It is a recurrent episodes of binge eating followed by compensatory behaviors like vomiting, laxative abuse, or fasting. Ang sign and symptoms is normal or slightly overweight body, tooth erosion, swollen parotid glands, and also electrolyte imbalances. At ang treatment is cognitive behavioral therapy, SSRIs like fluoxetine, and also nutritional counseling. Ato nursing interventions is in-monitor nato ang ilahang eating habits, prevent purging behaviors, and also encourage nato ang self-esteem building. Next is ang binge eating disorder. It is an episodes of excessive eating without purging, which magalid sa isa ka patient nga mahimong obesity. Ang sign and symptoms nato ani is frequent overeating, guilt, weight gain, hypertension, and diabetes risk. Our treatment is behavioral therapy, appetite suppressants, nutritional counseling. Our nursing interventions is encourage nato ang patient to mindful eating, monitor emotional triggers, and also mag-provide po taong mga weight management support. Moving on to psychosexual disorders. So, there are lots of psychosexual disorders nga atong i-discuss karon. First is ang gender identity disorder or now called gender dysphoria. So, muna siya ang distress due to a mismatch between gender identity and also assigned sex at birth. Ang sign and symptoms ani is strong desire to be another gender, discomfort with biological sex or social and also social distress. Ang treatment nato ani is hormone therapy, gender affirming therapy, and also psychological support. Ang nursing interventions is mag-provide tag emotional support sa patient, refer to any specialist, and also ensure non-judgmental care. Next is the hypoactive sexual disorder. It is a lack of sexual desire causing distress. Signs and symptoms are decreased libido, avoidance of sexual activity. Ang treatment is counseling, hormone therapy, and also psychotherapy. Under our nursing interventions are encourage open discussions, assess for underlying medical or psychological factors. Next is ang sexual aversion disorder. It is an extreme aversion or fear of sexual activity. Signs and symptoms are anxiety, panic, avoidance of intimacy. And treatment is CBT, exposure therapy, and also couples counseling. Our nursing interventions are address underlying trauma, provide education on intimacy, and also to your relationships. Next is dyspareunia. It is a pain during intercourse. Signs and symptoms are genital pain, discomfort, anxiety about sex. Our treatment is pelvic floor therapy, lubrication, treating infections or underlying causes. Our nursing interventions are we need to assess for infections, provide counseling, and educate patient on sexual health. Next is the vaginismus. It is involuntary muscle contractions preventing vaginal penetration. The signs and symptoms are pain, fear of intercourse, inability to insert tampons or undergo exam. Our treatment is pelvic floor therapy, dilators, and also relaxation techniques. Our nursing interventions is we mag-provide the reassurance, educate patient on any relaxation techniques. Next is ang premature ejaculation. It is an ejaculation occurring too quickly during intercourse. Signs and symptoms nato is inability to delay orgasm, frustration, and also distress. Ang treatment is SSRIs, behavioral therapy, and any topical anesthetics. Our nursing interventions is we need to provide education and techniques for any delaying ejaculation. Next is the female orgasmic dysfunction. It is difficulty achieving orgasm. Signs and symptoms are lack of orgasm despite stimulation. Treatment is counseling, any therapy, and also hormone therapy. Nursing interventions is mag-provide ng education sa patient, encourage nato communication together with their partners. Next is ang male orgasmic dysfunction. It is a delayed or absent orgasm sa mga lalaki. Ang signs and symptoms is difficulty reaching orgasm despite stimulation. Treatment is therapy, medication, adjustments. Nursing interventions is we need to assess ang ilahang psychological and physical causes. Next is ang erectile dysfunction. It is an inability to maintain an erection. Ang signs and symptoms is difficulty getting or keeping an erection. Treatment is PDE5 inhibitors like sildenafil or mga lifestyle changes and also counseling. Ang nursing interventions is mag-provide ng emotional support sa patient and also assess for medical causes. Next is ang sexual addiction. It is a compulsive engagement sa mga sexual behaviors. Ang signs and symptoms is loss of control over sexual urge and also risky behaviors. Ang treatment is therapy and also ini mga support groups. Ang nursing interventions is encourage natin ang patient sa mga therapy and also assess for co-reoccurring conditions. So, next is ang mga paraphilia. So, there are lots of paraphilias nga itong i-discuss karon, no? So, first is ang exhibitionism, which mag-urge to expose sa genitals sa mga strangers. Whereas, ang fetishism, muna siya ang mga sexual fixation sa mga object. Next is ang fruiteurism, which is nagarab siya against non-consenting individuals. Next is ang pedophilia, which is na attraction to prepubescent children. So next is ang sexual masochism, which desire for pain or humiliation. Then, sexual sadism, which inflicting pain for sexual pleasure. Ang next is ang transvestic fetishism. It is a sexual arousal from cross-dressing. Next is the voyeurism, which is peeping at others, undressing, or engaging in sex. Next is ang zoophilia, which is na-attract ang usa ka individual sa animals. Then, necrophilia, attraction to corpses. Then, coprophilia, which sexual interest sa mga feces. Next is ang urophilia, which is sexual interest sa mga urine. Partialism is a fixation on specific body parts. Telephone is scatologia. So, from the word a telephone, which means sexual arousal from making obscene calls. Next is a treatment for paraphilias. Ang mga treatment sa mga paraphilias is cognitive behavioral therapy, aversion therapy, SSRIs, and also mga anti-androgens. And autonomous interventions is mag-provide therapy referrals, educate sa patient, educate on legal and ethical concerns. Recognizing and managing mental health disorders is essential for improving patient outcomes. Through awareness, proper treatment, and compassionate nursing care, individuals can achieve better mental health well-being. Continuous learning and support are key to providing effective mental health care.